Hello, I'm Dr. Kiran Nandiwada, founder of this IRT program. I somehow feel knowledge must be like a river, unstopped. I'm handing over henceforth the moderation to one of our young research trainees. Today it would be Mr. Adnan Mirza. Welcome to all the participants and thumbs up to you, Adnan.
This will be a rapid fire round. Mr. Shabir, what are the skin disorders that you know are caused by low vitamin D?
Hello everyone. There's a lot, definitely. And one of the major ones is psoriasis, in which you have rapid cell growth and scaly skin. You also can have atopic dermatitis, also known as eczema, in which you have inflammation of the skin and irritation. AIBD, which is autoimmune bolus disease, is a rare, potentially life-threatening skin disease that could also be caused due to the circulation of autoantibodies throughout the desmosomes and hemidesmosomes. Moreover, you can also have alopecia areata, which is a skin disorder that is related to loss of hair follicles.
Why we should give a reference always is we should not speak without proof. When we don't have proof, better we speak not. That is why references are important. This is the psoriasis reference, autoimmune bullous disease reference, non-melanoma skin cancer reference. A good student seeing this video must pause this video, check the references, learn from the abstract of the article, then only move forward. Now we have Sagarika with us.
Mr. Sagarika, I have 3 questions for you. The first one, what neurological disorders can arise when chronic vitamin D deficiency exists?
Vitamin D plays an important role in neural growth development and maturation. It also helps in a synthesis of neural growth factors and controlling the dopaminergic systems. Hence, deficiency of vitamin D causes neurodegenerative diseases. It has been found that it plays an important role in the multiple sclerosis, and deficiency of vitamin D also plays minor roles in diseases like Alzheimer's, Parkinson's, autism, and even in schizophrenia.
The second one, have you researched about low vitamin D causing vascular and cardiovascular diseases?
Low levels of vitamin D favors atherosclerosis, enabling vascular inflammation, endothelial dysfunction, and also formation of foam cells and proliferation of smooth muscle cells. This may in later stages even lead to blockage of coronary arteries, leading to myocardial infarctions.
Is endometriosis linked to chronic vitamin D deficiency?
In recent researches, it has been found that low levels of vitamin D is a potential risk factor for endometriosis due to the presence of vitamin D receptors and enzymes for the synthesis of vitamin D present in the ectopic endometrium.
What is the toxic level of vitamin D and what are the symptoms?
A patient is said to have vitamin D toxicity when his serum levels are more than 150 nanogram per ml. Initial signs of toxicity is hypercalcemia, hypercalciuria, hyperphosphatemia, and hyperparathyroidism. In later stages, this may even lead to organ death and tissue death.
Mr. Ajin Matthews Jones, is low vitamin D linked to obesity?
Regarding obesity and low with vitamin D, obesity is associated with low vitamin D status, but weight loss has little effect on improving this. So the link between vitamin D and obesity remains controversial due to important limitations and confounding of studies. So more research is needed to clarify the complex interplay between vitamin D and adiposity. And regarding vitamin D and osteoarthritis, vitamin D sufficient patients have a lower risk of developing osteoarthritis and vitamin D sufficiency, and supplementation decrease articular cartilage degeneration radiographically.
Patients with knee early osteoarthritis show a lower level of vitamin D than matched controls and is significantly related to a higher intensity of pain, disability, anxiety, and depression.
And Dr. Kiran Nandiwara, I'm having difficulty understanding what DOI means. Could you please explain it to me? Additionally, could you clarify how to properly reference an article using the DOI? Thank you.
For the wonderful question. Now, I would like to say something. DOI is Digital Object Identifier. And in a way, what is it? See, for a student, even I am a student, we get confused. So, if I want to write an email to you, don't you think I have to give an email ID, or don't you think I have to produce for a postal? No, I have to write your name, door number, colony, street name, country, pin code, or the area code. Similarly, DOI or the journal identification number, your volume, your pages, when it was printed, all these things are important. You understand? So it's nothing very hard. But one thing I will advise all my medical students: whenever you have an abbreviation anywhere, please do not just write it as DOI. You write it as DOI, but when you read it, please read it as Digital Object Identifier. That way you will remember what it is. Otherwise, after a certain passage of months, you will say, scratch your head and say, yeah, what is DOI? So you'll always never try to read abbreviations, please. So when it comes to journaling and referencing, I would like to present a separate longer length video. Meanwhile, you see so much of sound going on, but you have not much concentrated on the sound. Correct? Why? Because you're focused. Like that, when you read, you'll have to weed out unnecessary sentences. You have to concentrate and make a mental image about the subject, and whenever a question is asked, you should be ready to answer it. Good luck.
Can low vitamin D cause ganglion formation and synovitis?
And if vitamin D deficiency can cause ganglionic cysts, the answer is yes. Vitamin D deficiency can increase the risk of an injury to the joints and the tendons, which in turn increases the risk of ganglionic cysts forming.
Is chronic vitamin D linked to any autoimmune disorders? Name them.
So, low vitamin D levels have been linked to various autoimmune disorders, including thyroid disorders and diabetes. As vitamin D plays a role in the immune system regulation, and the deficiency can exacerbate autoimmune conditions by affecting the immune response.
Mr. Jody Jojo, what are the changes in tongue, gums, teeth in chronic vitamin D deficiency?
Deficiency in vitamin D is associated with several oral health issues, including the increased risk of periodontal disease, dental caries, and oral mucosal condition. Studies have found that vitamin D deficiency can lead to burning mouth syndrome, which is a burning or a tingling sensation in the mouth, especially around the tongue. Certain groups such as elderly people and individuals with limited sun exposure are more at risk for vitamin D deficiency and its related dental health problems. So sustaining the vitamin D levels through supplementation can potentially improve the oral health conditions.
Chronic vitamin D deficiency and effect on ear and hearing disorders.
Now, vitamin D plays a role in auditory function, potentially through its effects in bone health and inner ear structures. The study found a significant association between vitamin D deficiency and both bilateral hearing impairment and bilateral sensory neural hearing loss in older adults. Now, assessing and addressing vitamin D levels could be important in management and prevention of hearing loss in older populations.
Now, I request our research mentor, Dr. Kiran K. Nandivada, to give his concluding remarks. Dr. Kiran K. Nandivada, founder of the IRT programs.
Thank you, Adnan Mirza. You've done an excellent job in your rapid fire question answer session. You are a great moderator, and I hope this experience will be useful to you in the future. And I thank all the participants who have done a great job. Now, as a concluding remark, I would like to tell first one thing. I did not mention about the bone metabolism, about calcium, phosphate, alkaline phosphate, the role of parathyroids, calcitonin, calcitriol, and I didn't talk much about the storage form of vitamin D, that is 25-hydroxy T3. There is a purpose. I want to take it up as a separate full-length discussion on rickets, congenital rickets, renal rickets, hypophosphatemic rickets. So many types of rickets are there. And then as we progress, osteomalacia And then osteopenia, osteoporosis is a big chapter which cannot be concised into 5 to 6 minutes. No, I will do it full 15 minutes later. Now, coming to there's a some questions were asked by my participants. Sir, uh, what is your experience in vitamin D creating malabsorption syndrome? See, you must have heard irritable bowel syndrome. Okay, you must have heard about ulcerative colitis, Crohn's disease. They are all the last end results of an initial disturbance. Vitamin D, when it is low, in my experience, I have seen a few important points. Vitamin D is low, it leads to malabsorption. When it is malabsorption, it is not selective. One vitamin or one mineral is not absorbed, nothing like that. Absorption capacity inside the lumen will be dysfunctional, which makes, please hear it very carefully. In my clinical practice, I have observed as they were non-vegetarians, I asked them, "Are you becoming a vegetarian nowadays?" Because there's a lot of people, who are shifting. They said, "No, doctor, I am eating." Then when I checked the blood tests which I did, B12 is very low. They are at 80, 50, 60 picograms per ml. I didn't understand this because meat is supposed to give the best source of B12 to the patients. Maybe it's the malabsorption syndrome because the vitamin D in the patients whom I saw, 4 or 5, they were all at 6, 12, 15 nanograms per ml. Since how long? I don't know. So what is happening to the gut? We don't know. Maybe the malabsorption is creating this vitamin B12 also to come down. And then these two, and we don't know what else is really acting in producing the status of little irritability. Patients will not tell. You have to ask them sometimes because they come for an orthopedic surgery, orthopedic surgeon's opinion. They think, why should I tell about my lumen, my bowel, and everything? They're not linked, so they will not discuss. You have to connect all the dots. So I asked them, what is your status of your stool? Sir, after eating, I have to run immediately to the toilet. So other vitamin B12 deficiencies are also, all the signs, symptoms are there. And then I ask them, what other history you have? Then they take out the medical reports. There is Crohn's disease in them. Some will have colitic treatment going on. So when I corrected all the vitamins, the symptoms came down. Similarly, a young lady of 23 years, remember I put a question, vitamin D and endometriosis. A young lady, 23 years, is very young. So she was very sad and she was discussing everything. I asked, what is happening, Amma? Your blood reports show vitamin is very, very low. I have endometriosis, doctor. Something struck me. Maybe this vitamin D, which is low for such a long time. So I just verified. Just like you, I'm telling you, just type what you want and put NIH article. It popped. Vitamin D and endometriosis are linked. So I said, dear Ma, maybe. I may be wrong. See, all these articles, sometimes some are very of very good standard, some are not. So, benefit of doubt. Anyway, you have to treat you for vitamin D supplementation so that it comes to your normal level. Please use it and give me a feedback. After 3 months, she just I have a regular touch with my patients. And she said, "Doctor, I feel very much better regarding the endometriosis part." And then I told her, it will not be so easy for it to go back to normal, but your pain and your cycles and other things, other symptoms of gynecology are getting rectified. I think we are on the right road to recovery. That's a kind of a small fatherly assurance I can give to a 23 years unmarried young student who is worried about her future. So these are the kind of manifestations I'm going to stress. That is the exact reason why I'm not talking about rickets, osteomalacia, osteoporosis. It is not the time. Time is not enough. Do you know that cancers can arise due to low vitamin D for a very chronic time? So, my point here as a conclusion is hundreds, thousands of articles supporting suspected or proven role of vitamin D. Why not take it? Why I'm concentrating on the youngsters? Become good doctors. That's all. It's not much I'm asking. I'm not charging any of these students because your life and the life of your patients is very valuable. With this, I end. Bye bye.